The funniest thing is the story, it was cause the occurrence umbilical hernia that came out. Someone might think maybe he was lifting weights and it came out, but it was an ordinary day, nothing remarkable. There were a few days left before the Myron Cup, so there was a deloading day. But no, I'm choking on food and start coughed, I coughed.
Bad cough. Blood in it.
Then I touched my navel and something looked from there. At first I thought that was a parasite from the matrix, so I want to spit it out. But remembering that I was not Neo, I began to think about other options. So, umbilical hernia. The umbilical hernia in an abnormal bulge of the can see the felt of the umbilicus belly button. The hernia develops when a portion of the lining of the abdomen, part of the intestines, and or fluid from the abdomen came through the muscle of the abdominal wall. As the fetus develops during pregnancy, there is a small opening in the abdominal muscles that allows the umbilical cords to pass through, connecting mother of baby. As the baby grows after birth, this opening in the abdominal muscle closes. Sometimes, however, their muscles do not meet and grow together completely, and a small opening remains. This opening is called an umbilical hernia. Sometimes the intestines get trapped within an umbilical hernia. Urgent medical evaluation, including an incarcerate hernia, is required in order to prevent possible damage to the intestines. It is uncommon for this to occur. But that's not all. After talking with the surgeon, we decide to make a white line surgery. The linea alba is fibrous tissue. It's a thin band of connective tissue that runs down the front of your abdomen. It separates the left and right sides of your rectus abdominalis, is sometimes called your six-pack ABC. It begins on the lower end of your sternum, breastbone, and ends of the pubic bone. It's highly elastic, like a rubber band, and strong, is an attachment point of the other abdominal muscles and helps anchor and stabilize your torso. People can have poor posture, pelvic and back pain, and other problems if the linea alba is weak. A condition called diastasis recti occurs when the abdominal muscles remain separate and cause a bulge in the abdominal. What is diastasis recti? Diastasis recti is when the rectus abdominalis muscles separate and being stretched. The separation can make you belly stick out or bulge. Even if the area does not bother you, it is very important without delay to see a doctor and determine future treatment. Hernias never pass by themselves, and over time they can grow and carry the risk of serious complication and even threaten the life of the hernia carrier. How is hernia treated? Treatment of hernia is always operational. There are no ways to treat a hernia without the use of surgical techniques. Surgical inventation, performance of hernias, hernioplasty, consists of removing the hernia sac, immersing the connect of the hernia into the abdominal cavity and straightening the weak spot in the area and the hernia gate through plastics. Currently, there are two types of operations for abdominal hernias: with tension and without tissue tension. Hernioplastic with tension. To date, there are a large number of different ways of plastic surgery of the hernia gate using their own fabrics. The essence of these methods is multiplane stitching of the musculoligamentus tissue in the area of the hernia ring. In this case, the edges of the defect experience some tension. This method is suitable for children as they usually have small hernias, and in adults this operation has several disadvantages. Firstly, the postoperative period, often processing with severe pain. Secondly, the healing takes 4-6 weeks. Pain syndrome contributes of the restriction of movements and exacerbation of contaminant disaster elderly patients. Such sitting of tissue leads to impaired blood supply to the muscles, aponeurosis, fecals, and as a result decreases the strength of the great structure. According to statistics, 10-20% of the operated hernia repeats. In addition, with the hernia of large and medium size, suffer insufficiently of muscle and aponeurotic tissues. Repeat hernias such as hernioplasty may be untenable. The above disadvantage and free from non-tension plastic surgery of the hernia ring. This technique can be used for any hernia, regardless of the shape and size, as well as the age and sex of the patient. Now for hernioplastic, various synthetic implants are used to avoid tissue tension during plastic surgery, treating dismembered tissue and significantly reduce the number of relapses. In the almost impossible to distinguish the implant from its own tissues after 6 months, the mesh becomes the skeleton of which the body-own tissues later develop. Future strengthens this weak spot. The number of replaces about this type of plastic does not exceed 1%. Remember that hernias do not pass by themselves, but over time, on the contrary, increase. The operation will allow you to return to your favorite activities very soon. But if think about it, problems already started when I was preparing for the Dnipro Powerlifting Fire and Iron Championship. 2 months before the operation, the result began to fall, and the desire disappeared. Although I did not give up the hope of making good total, a leopard can change his spots. And that problem must have been a long time ago. I remember when I did was several exercises at Ukrainian Strongman Championship, unexpected suitcases, then turbulence on moving.
I'd say severe turbulence, definitely severe turbulence.
Namely, in this exercise, the stabilizer is hard working and this is core muscle.
You like muscles?
So, Myron Cup, I decide to perform and then deal with the problem. But it's better not to do that.
No, that's a bad idea, Rick.
I'm warm up for squats 70, 120, 170, 220, 270 and 320 in knee wraps. And when I bandage my knees, I feel bad at all.
Call a doctor!
But then I go on the competition platform with 340, but 2 to 1 do not count for me. I was already thinking of withdrawing from the competition, but the organizer persuades me and I go out for one more attempt.
If you're good at something, never do it for free.
Let's do it again.
350 is counted. Pressing 250 without feeling sick is pretty good. It was interesting on the deadlift. 310 was hard on the warm-up. I didn't feel 340 on the platform, and in second attempt I didn't feel 370 either. If it wasn't for the soft platform, I threw me forward, but I bravely held it, but the muscles feels good, so I went for a 1000 kilos in total.
I got a ton of work.
And it's 400 in deadlift, but no, I didn't pull it.
It makes me sad.
Returning to Kiev, I began to resolve a situation with a hernia and deciding when and where to perform the operation. I have one idea of making a heavy pull from 3 cm splints.
What kind of freak idea was that?
For a more vertical body and reached over 420 kilos. And a day later I was already been on the operation table.
Chapter 2, right?
Chapter 2 Recovery. So after the operation I was in the hospital for 2 days. For the first 3 weeks I did not lifting anything heavier than 3 kilos. It was difficult, even in the work at gym I could not help anyone.
You can't help me anymore.
The next 3 weeks light load without involving the abdominals. Well, all this time I wear this bandage, but on the 57th day after the operation I do the first heavy squat. 70, 120, 160, 200, 230. Flying is normal, then at 260 it starts to connect the stomach muscle under load. I thought for about 40 minutes and went to 280 for 2 reps. The first repetitional thoughts were about the stomach, so I went very crooked well, so second repetition is good. The results of the squat are satisfactory. I'm feeling like my maximum is 310-320 as the 1 reps in knee sleeves. The next day it's time to test the bench press and deadlift. Since yesterday, in addition to squats, I did a standing press 120. Then a bench press is a real test, so I warm up well and start 70, 110, 140, 170, 190, 210, 220. At 210 I already start to feel my elbows. That's why I pull on elbow sleeves for 220. But they didn't help me to squeeze 2 times. Then the deadlift. The most interesting thing was understand
I didn't fully understand.
how the legs feel after yesterday's squats, but still 70, 120, 170, 220, 260, 300, 330, 350. But 350 were really surprised me.
Do you know that you're insane?
It's more comfortable for you to label me insane.
I thought it would be more difficult, but if in this condition I make such kilos, then in normal form probably no one will catch me.
Maximus the Invincible, who knows no fear.
So follow my results.